Welcome to Get Beyond the Buzz with your host, Susan Cromer. Join Susan and her guests as they explore the subject of medical marijuana and CBD, separating the myth from reality in the journey toward a better quality of life. It's about getting healthy, not getting high. Now, here's your host, Susan Cromer.
It is my pleasure to introduce you today to Dr. Rachna Patel, who has been practicing in the area of medical marijuana for a half-decade now, ever since 2012. She completed her medical studies at Touro University College of Osteopathic Medicine in Vallejo, California, and her undergraduate studies at Northwestern University in Evanston, Illinois. Dr. Patel step-by-step walks patients through how to use medical marijuana for their specific medical condition without them getting high from it, without them getting addicted to it, and without them smoking it. She speaks from the experience of having treated thousands of patients and having thoroughly reviewed the medical research.
Well, welcome, Dr. Patel. Let's get started with, how did you end up becoming a medical marijuana doctor?
Sure. So it all started when I happened on an ad on Craigslist that had said medical marijuana doctor needed. Now, my background is actually in emergency medicine, and while I was going through training, a lot of what I was encountering were overdoses on prescription medications, whether they were intentional or unintentional. I was also encountering a lot of patients that had become addicted to the prescription medications that they were given. And so a lot of what you ended up seeing in the emergency room were these addicts coming in, trying to finagle a prescription out of the doctors to get their fix, essentially. And then I also did a toxicology rotation, and the sole purpose of this rotation, there's actually an entire unit at the hospital dedicated to treating overdoses on over-the-counter and prescription medications. Now, I had started off wanting to save lives, probably like every other medical student out there. And I'm very attached to that purpose. So when I saw this ad, it definitely piqued my curiosity, and I decided to look into the research. And a year later, I was definitely compelled by the research, so much so that I decided, you know what, I need more clinical information. How is this actually playing out in patients clinically? So that's when I decided to work at a medical marijuana clinic out in Sacramento, and that was back in 2012. So I've been in the industry since then.
That's fantastic. So, well, what did your friends and family say when you were, that, what was their reaction to, oh, okay, so great, she's going to school now, she's going to be.
Well, I come from a very traditional, conservative Indian family, and I followed a typical path that every firstborn in the Indian family follows, which is to become a doctor, right? And so initially, I actually didn't tell my parents what I was doing in California. I had told them that I'm doing disability exams, which I did do on the side every once in a while, but it wasn't something I had pursued seriously. The thing that I was pursuing seriously was the medical marijuana. Now, what happened was that I come from a very big Indian family, and I started working at this clinic, I think it was towards the beginning of August, and sometime around the end of August, I find out that my cousin is having her engagement party 2 weeks later, mid-September. And I had figured, you know what, I want to really try this out, see what I find. And if I feel like I'm going to commit to it, then I'll tell my parents. But that time came a lot sooner than I had anticipated. So what I didn't want, and this is a respect thing, I didn't want my parents to find out from somebody else about what I was doing, something that they may have potentially not approved of. So I wrote an email to my brother, because you always get a sibling involved as a buffer, and he showed the email to my parents, and they flipped out, essentially. Basically, my mom was really worried. When my father got on the phone with me, his first question to me was, are you working for the mafia? And the thing is that my immigrant parents, their first encounter with America is New Jersey. And the mafia is a very real thing when you live in New Jersey. So So, I had a long discussion with my father. Now, my father struggles with psoriasis, especially psoriatic arthritis, and conventional treatment has never worked for him. So he's always looking for alternatives. And so during that conversation, he had mentioned that, yeah, I read a little bit about marijuana as an option for psoriasis. So, so over time, I think they've become more and more accepting of it. I'd say of my two parents, my mother is definitely a lot more traditional than my father. I have yet to hear the word marijuana come out of her mouth.
Now, are they still in New Jersey?
They are.
Yeah. So that is
Yeah.
not a medical marijuana state, is it? Is it?
It is actually.
It is. Okay.
It just recently passed. I think within the past 2 or 3 years it was
Okay.
passed. Yeah,
Okay.
but it's much more restricted than it is in California.
And your father has not tried it for his psoriasis, or don't want to say. We don't.
I haven't been able to convince him yet. So
That's funny. So would that because I know more about CBD. I'm not in a state where you can do THC.
Yeah.
I'm in Virginia. It's not a legal medical. Oh, I guess you can have medical marijuana under some instances. But anyway, how about CBD for that? Would that work on? Would CBD work? Which
So
is
both THC and CBD have anti-inflammatory properties. So in general, I found for autoimmune conditions, you really need both.
okay.
Yeah.
All right, good to know. Yeah, that's where we're still learning and trying to figure out what and I guess sort of sometimes I think, well, if you're in a state that you can't get, the THC, at least try the CBD and see if it works.
Well, here's something interesting that's going on with the CBD, and this was just a recent occurrence back in December of 2016. The DEA put out a statement saying that they're also classifying CBD as a class 1 substance as well, in addition to THC. Now, I believe there's some sort of hemp association of some sort that's filed a lawsuit saying, well, that's not within the DEA's jurisdiction to implement that. So I think they're still trying to work it out, although they did say that the law would go into effect starting January 2017. So it's all fairly recent.
Right. I know that was a big scare, and I should know exactly the details, but they kind of backed off on that. And it was I don't know, but everybody that was dealing with, or it's manufacturing CBD and selling it, it's like, okay, we're okay. It was sort of like they just are some kind of paperwork kind of shuffling kind of thing is what it was our understanding. So we're still good to go as far as our lawyers have said. So what conditions do you commonly treat with medical marijuana?
Sure. The most common conditions that I end up treating are chronic pain, anxiety, and insomnia.
Wonderful. And all ages? I mean, is there a cutoff on age or?
No, actually there isn't. I've treated children, fairly young children, around the age of 5 to 6. These are mainly children with autism, and a big component of autism is anxiety. So I've used the medical marijuana to treat children as young as 5 and 6, all the way up to, I have even up to 90-year-olds come into my practice. Okay,
so then that leads to then how these children getting high? We're all about get beyond the buzz. It's about the health, not the high. So how do you treat them without them getting high?
Fundamental concept that you want to know regarding any medication, and that is that there's a range of dosing when it comes to medication. Okay, so you have a subtherapeutic range, you have a therapeutic range, and you have a toxic range. Now, the subtherapeutic range, the dose isn't high enough to give you any effect, let alone even side effects. Okay. The toxic range, you're taking such a high dose that you're not now experiencing side effects. And then there's that sweet spot, the therapeutic range. And that's where you're getting the medical benefits, but you're not experiencing any side effects from the medication. And a lot of the side effects of marijuana are what's called dose dependent. So if you take more, you're more likely to get side effects. as more as in a higher dose.
Right.
And if you take less of a dose, you're less likely to experience side effects. So that's what I'm walking my patients through, how to hit that therapeutic window when it comes to dosing. I'm also guiding them on combination of chemicals, because that certainly has an impact on the effect that you'll have. THC is known to be the psychoactive substance in marijuana. And really every plant makes a different combination of these chemicals naturally, whether based on genetics and based on the environment in which the plants are grown. So, if you walk patients through all these steps, they're able to use medical marijuana in a way where it's giving them medical benefits without having to experience the side effects of it.
Now, from my understanding, that's where the strains come in. And if again, I'm not in a medical marijuana state that they have the dispensaries, but my understanding is you can go in a dispensary and you'll say, here's my prescription for anxiety or depression or whatever, pain. And they'll say, okay, here are 6 strains or 10 strains or whatever to choose from. And that's because they have a different ratio of THC and then the cannabidiols that are in the other good ingredients that are in hemp or marijuana that help with the conditions. Is that correct?
Yeah. So here's the important thing to know when it comes to strains. You've probably heard of these strain names: Sour Diesel, Granddaddy Purple, Purple Trainwreck. Sort of, the industry's been creative, to say the least, right? Here's the important thing, though. They actually have done research on these strains, and they found that say, you take one strain, Harlequin, for instance, they found that from dispensary to dispensary, and even at the same dispensaries, the amounts of the THC and the CBD vary, right? So the point is that when it comes to these strain names, they're named very arbitrarily. So you don't really want to make a purchase based on the names of the strain. What's more important is that you purchase a product based on the fact that it's laboratory tested, and that laboratory testing will then give you exact amounts of the different chemicals. That's a much more accurate way to use medical marijuana.
Okay, that makes a lot of sense. So, okay, so how do they use it? Do they have to smoke it?
No. You have a wide variety of options available to you. In fact, I generally recommend that my patients don't smoke marijuana because long-term it does do damage to the lungs. So an alternative method of inhalation is called vaporization. And essentially, you use a device called a vaporizer, and that then heats the plant. And it's almost, I like to equate it to a diffuser for essential oils. You're basically, that's what you're inhaling, are the chemicals that are being vaporized, right? You're not getting the tars or what's known as the polyaromatic hydrocarbons that are then doing damage to your lungs with smoking. There are also topicals, and these are like ointments and salves that you can use for purposes of muscular pain, skeletal pain. You can use it for skin conditions as well. Then there are tinctures. So these are drops that you use under your tongue. There are also rectal and vaginal formulations of marijuana as well. So a wide variety of options that are available.
I guess those could come in real handy for children if they were nauseous or whatever, just say
even
having a seizure,
patients.
maybe.
Yeah.
Okay, so the vaping, by the way, I have, from my research, I had heard that you actually get more of the good parts of the plant from vaping. Like, I don't know, it's high in the 90s amount of all the good things that are in the full spectrum benefit of the plant, where some of that gets burned off if you're actually smoking it. You don't get necessarily all the good stuff.
The results of the studies have varied. Some have shown that you do get a greater percentage of the cannabinoids, and then some have shown that you get about an equal amount as smoking. So we need
more research on that, but we makes sense that the smoke isn't helping anything.
Yeah, right.
How does marijuana relieve pain?
A couple different ways. Okay, so one is that it reduces inflammation, right? It acts at the level of the different cells that we have in our bodies. One of the things that it does is that it impacts the release of what are called cytokines. Cytokines are the signaling chemicals that start and stop inflammation, right? So what marijuana does is that it suppresses the production of these cytokines. That's one way. Another way is that it alters the perception of pain, mainly in two areas of the brain. One is the amygdala, and the second is the anterior mid-cingulate cortex. What's interesting is that these areas are involved in the emotional processing of pain, right? So in addition to feeling physical pain, your brain is also telling you this doesn't feel good. So somehow marijuana alters that signal. And what it does is that it's almost like it's telling your brain, you know what? It doesn't feel, it's all right. It doesn't feel that bad. And then the third way is that it modulates pain along the pain pathways. So basically, you have a certain signal. Say your hand is next to something really, really hot. So you have receptors in your hand that are then telling your brain that, hey, that this hand is next to something really, really hot. And the brain then decides, okay, I need to move this hand away from the source of heat. So it sends signals out to muscles, for instance, that know how to move the hand away from the source of the heat. So basically, what marijuana does is that when you're feeling pain, it almost dulls the signaling that's going to the brain. And so the pain's there, but a lot of times my patients will say things like, the pain's not bothering me as much when I use the medical marijuana, or that the medical marijuana is taking my mind off of the pain. So all of these different things may be contributing to that.
Fascinating. Talk about results for with your patients. What
Sure.
type of results?
Sure. So when it comes to pain specifically, a couple different results that I've seen. One is obviously that it helps patients to reduce their pain, right, overall. But the interesting thing is that when I had first started off, one of the studies that I had read indicated that marijuana helps to reduce the use of opioids. And in that particular study, it just showed a reduction in, it helped to reduce the dose. So I figured that, okay, marijuana will be one of the medications that patients can use in their arsenal to treat pain. But what happened was that once I started treating patients, they would return to me the next year and they would say, I've stopped using my opioids.
That is fantastic, because that's such a problem in our country.
It is a tremendous problem. And so that's one of the things. Now, for the patients that are not able to eliminate their use of prescription medications, they are able to reduce the dosages of their prescription medications, or they're able to reduce the number of prescription medications that they're on. And then in very rare cases, I do have patients that aren't able to reduce either the number of prescription medications or the dosages, but the marijuana still helps in reducing their pain overall. In combination with the prescription medications. And then the most important thing is that by reducing pain, you're improving a patient's quality of life, right? So this can be, I've had patients tell me little stories like, I'm able to carry my grandchildren again. That is huge,
That's
right?
huge.
That can have a huge impact on a person's quality of life. Even something as little as being able to well, this is big, I wouldn't call it little, but being able to exercise. A lot of patients that otherwise had been exercising have to stop exercising because of the pain that they're experiencing, and that then has a huge impact on the quality of their life. But they're able to go back to going on 30-minute walks.
What was their normal life, though?
Exactly.
And also, I think with those type of patients, they're not taking it for recreational reason.
No.
And they probably feel guilty or bad about themselves or whatever, that they can't stop taking that and return to their life. And I mean, it's a horrible
and one of the most
situation
common
to be in.
things that patients tell me is that, look, I'm not looking to use marijuana to get high. And that's the case with all my patients that come in. They're really just looking to use it medically.
Okay, so that brings us to, is marijuana addictive? Because there's so many people that still think, it's a gateway drug and you're going to get addicted and they're going to have,
Yeah. So it does have potential for addiction, right? But let's put that into perspective. The potential, so there was this one study that was done and they looked at marijuana users that had been using marijuana on an everyday basis, sometimes even multiple times a day. And these users had specifically admitted that they were using marijuana to get high, right? So they're really looking at a recreational population. And what they found was that the potential for addiction was 9%, so 1 in every 11 people, okay? But it's a lot less than alcohol, which is about 24%, and alcohol is about 14%, and tobacco is about 24%. And I think cocaine falls at about 12%. And of course, it all depends on how you're using these substances, right? So the example that I always give to my patients is, if you have a glass of wine on an everyday basis versus having a case of beer, you're not likely to get addicted if you're using a glass of wine. So the information that's missing is what's the potential for addiction in medical users, right? So these are patients that are definitely not using it as much as a recreational user. So that's the piece of information that's missing. But clinically speaking, what I'm focused on in my consultations is on a lowest effective dose and a minimal frequency. And in the patients that have returned to me year after year, nobody has reported that they feel like they're needing higher and higher doses of the marijuana because they've built up a tolerance to it, right? So that's the start of a dependence, and that hasn't been the case.
That is a big thing, because that's what, again, I'm not a doctor, but I know from people, with painkillers,
Mm-hmm.
you end up with a tolerance and you have to take more and more and
Right.
more. Me helping people use CBD, it takes a lot of times to tell them, no, you might use it more at first, but you're going to titrate back. You're actually going to end up taking less once those CBD receptors kick in and it's working for you. You don't have to keep taking more and more and more like you do with painkillers,
Right.
if
Yeah.
you're consistently on them or frequently have to. So
Yeah,
it's
and
a different mentality.
essentially, it's really an as-needed medication. So if you're using it in moderation, you can come off of it without experiencing any withdrawal symptoms.
How about side effects?
Side effects, yeah, you can get side effects, but like I mentioned before, it all depends on dosing, right? So if you keep your dosing within that therapeutic window, in all likelihood, you're not going to experience any side effects.
But the side effects aren't going to be death, or
No,
things
actually, yeah.
like you see, or, if they had I can imagine if they had a TV commercial for marijuana where it wouldn't list, you could end up with, paralysis or blindness and,
Right.
all the stuff that you hear in aspirin, you
Yeah.
go, I'm not ever taking aspirin again. It's
Yeah.
like,
So the DEA had put out a statement long ago. There was their administrative judge made a statement that said that you'd have to consume 1,500 pounds of marijuana within 15 minutes for a fatal overdose. So that's nearly impossible, right?
Yeah,
From a
yeah.
practical perspective.
Yes.
So it is, and there haven't been cases, as far as I know, that have been found that have caused a fatal overdose specifically just from marijuana use. And of course you can overdo it, right? Worst case scenario, side effects that can happen if you overdo it, you can get hallucinations, you can get paranoia, it can make you anxious. It can also cause dizziness, it can cause your heart to race, but again, it's all dose dependent.
Mm-hmm.
So it typically happens if you overdo it.
And I have heard that CBD counters the THC can help offset if you take just CBD, if you had too much THC. I don't know if you've experienced that or not, but that's what I've heard, that if the CBD will help bring down the THC reaction if you had a bad side effect.
I have looked at the studies on that, and does one when taken together, does one help to diminish the side effect of the other? Yes, but if you have something in your system and then you take one of the other chemicals? Does it counteract the side effects? That hasn't necessarily found to be the case, right? So when taken together, yes, one does diminish the side effects of the other.
I think we need a lot of studies done that are unfortunately, maybe happening, or a lot of them can't happen. And, we're in that sort of weird place still. So but anyway, hopefully we will continue moving forward. And
I'd say we're making progress.
Good.
I mean, I think the biggest barrier is that it's classified as a class 1 substance, right? So, but there are companies such as, I don't know if you've heard of GW Pharma. They've made a proprietary formulation called Sativex, which basically has about equal amounts of CBD and THC. So they're doing quite a bit of research. They're based out of England, and they've obtained special permission to do research, I think, in the United States as well. And so all of that research helps to contribute to the existing research and does give us more information.
Great. Is that, by the way, is that synthetic, or is it the real deal? Do you know?
It's an extract from.
So it is from the plant, because I have heard of some synthetic things, which I don't understand. That's like
there
my
are
own.
synthetics. Basically, synthetics are just chemicals that are made in a lab. It doesn't actually come from the plant itself, right?
I mean,
so these are medications like, I don't know if you've heard of Marinol. It's a very commonly prescribed medication for patients who are undergoing chemotherapy, and they have what's called irretractable nausea and vomiting. So basically, their nausea and vomiting is not reacting to conventional treatments, and therefore, they get prescribed Marinol. And that is the synthetic version of THC, which is what's in the marijuana plant. Yeah.
Well, in my opinion, that doesn't make any sense. When we can use it from the plant, I understand why they're doing it, because of because of our government's restrictions. But when you have this wonderful natural plant that you can get it from, why make it up? But
so what's interesting is that my patients that I've had quite a few patients come to me that were prescribed Marinol, and they preferred to use marijuana products that are derived from the plant, because what's going on is that with the synthetic version, they experience side effects, right? One of the most common side effects that patients complain of from Marinol is dizziness. And so they prefer to use the plant because they're not experiencing these side effects. And it may be because, like I mentioned, because you have other cannabinoids such as the CBD, which helps to counter the side effects of the THC. That's not the case with the synthetics. Synthetics, it's just highly concentrated sort of a lab version of THC.
All right, let's see if I got everything here. Okay, here's who should not use medical marijuana? Is there anyone?
Yeah, so a couple of groups of patients. The first is patients who've a couple of groups that I recommend with caution. Okay, so patients who have a history of psychotic episodes. So these are typically patients that have been diagnosed with schizophrenia or bipolar disorder. And I say this because, like I mentioned, one of the side effects of marijuana is that if you take too much of it, it can cause hallucinations. Right? So these are patients that are already prone to hallucinations. And so anything that can kind of push them over the edge is more likely to throw them into a psychotic episode. Second group is women that are pregnant or breastfeeding. I err on the side of caution and don't recommend medical marijuana to them. And that is because, the studies, there are some studies that point to the fact that women that have used marijuana while pregnant for a period of about at least 20 weeks during the pregnancy, they are prone to preterm labor and delivery, and also the the newborn child is more prone to low birth weight as well, okay? Although there are studies that have shown otherwise, where there isn't a tendency for preterm labor and delivery and low birth weight. So the jury's kind of out, but I err on the side of caution in terms of how I practice. Third group of patients, anybody that has emphysema, asthma, COPD, obviously shouldn't be smoking marijuana.
Right. Or anything.
Yeah, exactly. And also anybody that has any heart conditions, like dysrhythmias, for instance, because again, like I mentioned, one of the side effects of marijuana, if you overdo it, is that it can increase your heart rate, and then it makes you more prone to being thrown into that dysrhythmia. So these are the main groups of patients that I would either not recommend medical marijuana to, or if I do recommend, it would be with great caution.
So start a super low dose and be vigilant and that type of thing if you were going to go forward with it? Is that you know?
Yeah, be extremely cautious is what I would say.
Yeah. Okay. I think we've gone over everything you said. Okay, here's one. Mine. Tell us how medical marijuana has impacted your life.
Impacted my life personally?
As a doctor, personally, or a doctor, yeah.
Okay, sure. So overall, it helps me to fulfill my purpose. I am somebody that grew up in an underprivileged neighborhood. You know, it was a community of blue-collar immigrants, essentially. But I got lucky, right? The odds were stacked against me, but I got lucky because my parents worked hard enough to be able to move to an affluent suburb where I now had access to the best education in the state of New Jersey. Okay, so this was a gift, essentially a privilege that I experienced. And so one of the things that I wanted to do with this gift and this privilege was, how can I use this now to make an impact on people's lives? How do I change their lives? And like I mentioned, as I was going through my training in emergency medicine, essentially I felt like I was giving out prescriptions to kill more than anything. And so by being a medical marijuana doctor, I'm able to fulfill that purpose. I'm hoping eventually that this is the alternative to opioids, and hopefully then I'll be able to save millions of lives.
Yes, because it is a horrible epidemic in our country, and you know, it's frustrating for those of us that realize what medical marijuana can do to alleviate the problem, and you know, is still trying to get the word out there and let people know. Okay, so is there anything people can do that aren't in a state where, you know, they can get access to medical marijuana? Is there can they come to California and see you? Or I mean, I guess then they can't take it outside of the state legally.
Yeah. So that's a tough question, right? We are making progress. We do now have 8 states that are really legalized for recreational use, so that makes things a little bit easier. Although we'll have to see what the new administration does.
Right.
It's a tough question because you're bound legally in terms of where you live. You're bound by the laws of your particular state. So the information that I give is most beneficial to those that live in a state where marijuana has been legalized for medical and or recreational use, because the crux of the information that I give, what's most important to it, is that whatever you get is laboratory tested.
Right.
And in states where it's been legalized for either recreational or medical use, products are generally laboratory tested. In a lot of states, it's actually state mandated. There are, like I mentioned, there are synthetic versions of marijuana. There's the Marinol. There's I think the trade name is dronabinol as well, or that may be another synthetic medication. That is an option. Otherwise, it's tough. I don't really have an answer to that question.
Yeah, but I guess not. I guess here's the question. I'm putting you on the spot, but
Yeah.
I was just curious if
Mhm.
can somebody go from another state that's not legal and see a doctor in a state where it is legal? And
Well,
or do you have to say, no, you don't live in this state, you're not in a legal state, so I can't see you? Or
depends depends on the residency requirement of the particular state. I know, for instance, in the state of California, where it's legalized for recreational use, there is no residency requirement. In other states, in California, it's a bit in the gray area whether or not there is a residency requirement. I don't think it's actually specifically stated anywhere, but everybody in the industry tends to err on the side of caution. And they do require, I myself require that whoever sees me is a California state resident.
Okay.
So I do ask for proof of residency. This is specific to when I'm issuing the documentation, such as the medical marijuana card and the medical marijuana recommendation. In terms of the information that I provide, obviously there is no requirement for state residency.
Right.
But again, it would be most useful to those that are in states where products are laboratory tested. So it's a tough situation that we're in right now,
Yes.
where it's not necessarily accessible to everyone. So
one of the problems that I will be speaking to the American medical refugees. So you have the people that have had to leave the state, leave their job, and go to a state where it's legal to treat their children or themselves or whatever, because it's not. And that is a really sad situation that, again, we're trying to educate people and, appreciate you speaking and, letting people know, more and more, because so many people don't. Now, you spoke about testing. That's one thing we talk about with CBD, because there's such a wide variety of products, and a lot of them say CBD, but they really don't. So we always recommend as well that it's full spectrum, and that that it is tested, that they have test results with it, because it makes a difference, so it's the same with the if you're actually using marijuana with the THC, again, the CBD doesn't have the THC, or very low amount of THC, and that's why it can be sold in all 50 states,
The other important thing is that with laboratory testing, this is especially important for anybody that has a compromised immune system. It's also important to look into laboratory testing that's been done for the presence of fungus and bacteria. And then just in general, also laboratory testing that's been done for levels of pesticides and fungicides, right? Because excessive amounts of certain pesticides and fungicides can be neurotoxic. It can cause damage to the brain. So those are other things to look for when you're looking at laboratory testing in general.
Great. That's really good information. Thank you. Well, this has been wonderful. You've been very, very informative. I may have to interview you another time and get some more information. But let's end with what's the real buzz you want everyone to know about medical marijuana?
Here's the thing. In general, knowledge is power. So I would recommend that always turn to credible sources of information, and always make sure that you're making a well-informed decision when it comes to your health. I'm from Jersey, so I always like to say, don't buy the bullshit that people say, right? So just make a well-informed decision, go to credible sources for information, and then base your decision on that.
And that's what what we're trying to do is educate people, and we say, look it up, check it out, here's some good information we're, putting on our website to so that people know. The more they know, the more informed decision they can make. Yeah. How can they find out more about you if they'd like to?
Sure. So a couple different ways. One is through my website, which is drrachnapatel.com. And so it's DR and then my first name, which is RACHNA, and then my last name, which is PATEL. And then, if your viewers or listeners have questions for me, they're more than welcome to post them on in the comment section of my YouTube channel, which you can just Google YouTube, the Medical Marijuana Expert, and my channel will show up. Otherwise, you can also leave comments on my Facebook page. And what I do is every 1 to 2 weeks, I put out videos answering very commonly asked questions. And most importantly, what I do is I back up my response with research. So So yeah, that's another way to get your questions answered.
Oh, great. That's very helpful. We will put that information on the on the blurb for this site too, so everybody will have that then if they didn't catch it. So thank you again.
Yeah.
You've been wonderful. And I thank you, and I'm sure my listeners thank you for what you've done. You are a pioneer in the field, and I appreciate that you have gone forward. I hope that your parents realize how wonderful what you're doing is, and that you're making history, and I'm proud of you myself.
Thank you. I appreciate that. I appreciate it.
Thanks.
Yeah.
Please go to www.getbeyondthebuzz.com. We have lots of information there to help you gain the knowledge you need to safely and effectively use medical marijuana and CBD. Listen, learn, share what you hear so people don't suffer needlessly. That's it for now. Until next time, this is Susan Cromer. May you be healthy and prosper.